All right, so for the next up, we'll aim at discussing all those words. How will I put it? We'll aim at discussing all those behavior disorders, right, that might actually come up in pregnancy, you know. So for the first one, which we'll be talking about is what is known as a perinatal bipolar disorder. So it's simply like, okay, this person is having a bipolar issue, but this bipolar issue is coming up because, you know, they're in the perinatal phase. Perinatal phase is just, you know, around the pregnancy time. Peri is around, natal, you know, pregnancy related issue. So for the perinatal bipolar issues, the woman is having some type of mood swings, all right, anxiety issues, depression issues, and it's linked to the pregnancy, which we'll talk about some reasons which could actually make a woman tilt into this, you know. So it also refers to it's like a bipolar disorder, and this bipolar disorder is coming up during the pregnancy time. All right, so it's a serious mental health condition. It involves extreme mood swings. All right, the person's personality is literally changing up, you know. So from deep depression to elevated mania. So it requires careful managing. Now this is because it can have impact on the woman. It can have impact on her spouse. It can have impact on the baby. So what it looks like. So the woman is having depressive episodes. Okay. So she's sad, you know, fatigue. She's feeling hopeless. Withdrawal. Okay. So also manic and hypomanic episodes. She's having elevated moods, sometimes racing thoughts, impulsivity, okay, decreased need for sleep. Psychotic symptoms like hallucination, delusions, paranoia. Alright. So these symptoms, they severely affect the person's ability to even care for themselves. Alright. If somebody can't even care for themselves, how can they care for the baby? Do you understand? So it may actually increase the risk of postpartum psychosis, okay, especially in those that have a history that is linked to psychosis. You understand? So risks during pregnancy and postpartum is relapse risk is what? High if treatment is stopped. So if there's a treatment being given to this woman, she should stick to it. You know, may lead to poor prenatal care. All right. She might actually even use some one or two substance, all right, to get away from the depression, and this can actually affect the baby. There's increased risk of her giving birth to a baby, and the baby is born before the time that they are due. Okay, they are also born with the weight not being to the optimal. All right, then obstetric complications like preeclampsia. All right, so lithium is one of the lithium, a common mood stabilizer, requires close monitoring during pregnancy and postpartum. Can be used. Okay, so I think it's supposed to come here. So mood stabilizers like lithium, but careful dosing is needed. Okay, psychiatric care, where she have to talk with what obstetric and gynecology specialists. She also has to talk to mental health professionals, like all the psychologists that were actually what properly trained for this. Then psychoeducation, support groups, she should link up with her friends, feel happy again. Then they are still monitoring her during pregnancy and after birth, okay, to know the type of treatment she'll be needing all along. Alright. So that's just what the perinatal bipolar disorder simply is. Okay. What it looks like. Okay. That's the main thing. Okay. That's how the person is feeling.